What is a phobia? According to Harvard Health, a phobia is a persistent, excessive, unrealistic fear of an object, person, animal, activity, or situation. It is regarded as a type of anxiety disorder. Unlike other kinds of anxiety disorders, a phobia is the fear of an object, which is usually the source of the fear. The object could be material or even immaterial. It could include situations, things, and places. Recent studies have shown that up to 15% of the world's population have one phobia or the other. In America alone, an estimated 19 million people have one or more phobias. These different cases range from mild to severe. While the what of a phobia is usually straightforward, the why could sometimes be unknown. What causes a phobia? Phobia is fear of a thing, whether living or not, material or not. This fear can either be genetic or learned over time. While it may sound bizarre, scientific research supports that the genetic inheritance of phobias can occur. Although there is still no accurate explanation for this, there have been recorded cases where people have a phobia that is present in a family member. In some cases, it's beyond mere genetics, as the environmental condition causes some people to develop a phobia. Events and places can lead to the development of a phobia. Take, for example, a person who almost drowned in a lake. Such a person might develop aquaphobia, a fear of water bodies. These environmentally developed phobias are closely related to traumatic experiences the victims had in the past. What are the different types of phobias people experience? To make a list of all the different phobias in the world is indeed an arduous task. However, there are 3 general categories into which all kinds of phobias belong. They are specific phobia, agoraphobia, and social phobia. Specific phobia is also known as simple phobia. These kinds of phobias are related to a particular object or situation. For easy identification, these phobias are subcategorized further into these categories. These are phobias that happen because of fear of an animal. It could be any animal, wild, domestic, insect. This kind of phobia involves fear of environmental and natural phenomena. They include fear of things like storms, water, and heights. Specifically, this fear appears when people are in the hospital and related clinical places. However, it can happen outside such spaces. It involves the fear of needles, invasive medical procedures, and blood. Specific situations often trigger these phobias. These triggering situations may include fear of flying, enclosed space environments, or other similar situations. Other situational phobias do not fit into a specific category. This kind of phobia is becoming increasingly common in our day and time. This kind of phobia happens due to being found in public situations that can lead to embarrassing or humiliating moments. This phobia involves the fear of being trapped in a crowded space without any means of escape. This phobia makes people get anxious and stay in their houses to remain safe from crowds. Some phobias are more common compared to others. These common phobias usually happen and are most times general. A typical example is arachnophobia, which is the fear of spiders. It is said to be among the most common phobias in the world. These phobias are not so ordinary compared to the others listed above, because people could develop a phobia for almost anything at any stage. As a result, it could get challenging to keep track of phobias. An example of these phobias is pogonophobia, which is the fear of beards. While different people might report various symptoms, the most typical sign is panic. Panic can feature reactions such as pounding or racing heart, shortness of breath, rapid speech or inability to speak, dry mouth, upset stomach, nausea, elevated blood pressure, trembling or shaking, chest pain or tightness, a choking sensation, dizziness or lightheadedness, profuse sweating, and a sense of impending doom. Notably, the absence of panic doesn't eliminate the possibility of a phobia attack. While this fact may not be as popular as phobias, it is true. There are treatment remedies for phobia. There are two basic ways treatment is administered: cognitive behavioral therapy and medicine. This method involves exposure to the source of fear in a conditioned environment. This method identifies and nullifies negative thoughts, dysfunctional ideologies, and adverse reactions toward the said object of fear. Overcoming phobia challenges would help the person get used to their fear and reduce or extinguish phobia over time. In today's world, virtual reality has exposed people to their object of fear in a very safe environment. The use of medication like antidepressants and anti-anxiety medications can help calm the person involved and help them react more positively. Experts have often advised using a combination of both medicine and therapy. How to help people with a phobia. Suppose you know a person with a phobia. It's best to help them and encourage them to overcome it. Here are a few things you can do to help them. Be supportive. Encourage them and speak to them calmly about their phobia. Try to understand their phobia. Be patient with them. Please don't put them under pressure. Do not mock them or make fun of them about their phobia. Please do not put them in situations that scare them. Phobias are a part of our world. People will continue to develop phobias and will have to face their fears occasionally. Knowing how to act when we have them or when others have them would help us make the world a better place. 𝘄𝘶𝘆𝗶 is the fear of the police or the fear of getting arrested. Due to the nature of 𝘄𝘶𝘆𝗶, this can prevent public safety in many communities. Many people living with 𝘄𝘶𝘆𝗶 avoid reporting crimes due to the fear of direct law enforcement interaction. Report hate crimes in your school, church, workplace, or neighborhood anonymously. You can make a difference by reporting hate crimes to your local authority. Suppose you are afraid of the police or law enforcement and don't want to report a crime directly to your local police authority. In that case, you can choose to report hate crimes safely by using any of our domestic or international privately owned anonymous crime reporting resources listed on our website at www.𝗓𝗏𝗏𝐼crimereporting.org. Reporting anonymous crimes often leads to a more honest report of the crime from people living with 𝘄𝘶𝘆𝗶 because they are not interacting directly with law enforcement, the trigger of the phobia itself. This video message was written by 𝗵𝗫𝗆, President of Anonymous Crime Reporting, Incorporated. Please visit www.𝗓𝗏𝗏𝐼crimereporting.org to find out more about 𝘄𝘶𝘆𝗶, anonymous crime reporting, and valuable tools for your church, school, or workplace.